Hi there, my name's Brian Thurber. I'm a neuroradiologist with an interest in medical education. This is a video about the midline structures of the brain. We'll use this sagittal T1 weighted MRI to orient ourselves. First, I'll point out the corpus callosum seen here. The corpus callosum goes from the splenium most posteriorly, up to the isthmus where it narrows, then to the body seen here, and genu where it bends anteriorly, and finally the rostrum, which projects slightly posteriorly off the genu and is seen right here. The band right here coming off of the corpus callosum is known as the lamina rostralis and is horizontally oriented. It courses down this way and then becomes the lamina terminalis right here. The lamina terminalis is right adjacent to the anterior commissure. The anterior commissure is represented by this small bump of tissue right here, just behind the upper portion of the lamina terminalis. Following down the lamina terminalis, just anterior to it is a cistern, known as the lamina terminalis cisterna. This houses the anterior cerebral arteries, the flow voids of which are seen here, as well as the anterior communicating artery. The lamina terminalis ends down here at the level of the optic chiasm. The optic chiasm is the point at which the optic nerves cross and then continue posteriorly as the optic tracts. Let's now talk about the floor of the third ventricle. We'll notice that this floor is not very flat, but rather consists of these anterior-inferior projections or recesses. The more anterior one here next to the optic chiasm is the supraoptic or chiasmatic recess. More posteriorly, this one here is called the infundibular recess. This is the infundibulum or pituitary stalk. Right here, the structure between the mammillary body and this infundibular recess is known as the tuber cinereum. A little bump of tissue here known as the median eminence marks the beginning of the infundibulum. The pituitary gland itself is down below and is in continuity with the pituitary stalk. We'll notice that it has an anterior portion, which is more T1 isointense to the rest of the brain tissue, and then a more posterior aspect here that is T1 bright. The T1 brightness here is attributable to vasopressin. The anterior lobe of the pituitary may also have increased signal on T1 weighted sequences in cases of hormonal hypersecretion, as will be seen with pregnancy, lactation, or in the early neonatal period. The anterior pituitary or adrenal hypophysis consists not only of this pars distalis component within the sella turcica, but also consists of a pars tuberalis, which is part of the infundibular stalk and has many capillaries from the hypophyseal portal plexus, and then also the pars intermedia, which is a vestigial structure separating the anterior pituitary from the posterior pituitary in this region. Sometimes pars intermedia cysts or Rathke cleft cysts may be seen in this region right between the anterior and posterior pituitary glands. If we go back up posteriorly along the floor of our third ventricle, we should next talk about the posterior portions of the third ventricular wall, formed by the posterior commissure, seen here, the pineal gland, and the habenular commissure up here. Between the habenular commissure and the pineal gland is the suprapineal recess, and between the pineal gland and the posterior commissure is the pineal recess. If we follow down our cerebral aqueduct in this area, we're going to reach the fourth ventricle. The fourth ventricle has a roof along here, which consists of the superior medullary velum, the fastigium right here, and the inferior medullary velum going down. The point right here where the fourth ventricle narrows is called the obex and marks the opening down into the spinal canal. The roof of our third ventricle will be formed by the talochordiae, which is a portion of the choroid plexus along here. The structure we see here is the massa intermedia, which connects the right and left thalamus. Scrolling off midline just a little, we're going to see our thalamus here going over to midline through the massa intermedia at this point. The forniceal body is seen just above the thalamus right here. At the point right here, it will split into right and left columns, which will converge down below into the mammillary bodies on each side. The forniceal columns also have some pre-commissural fibers that are in front of the anterior commissure, but most of them are seen behind the anterior commissure to go down into the mammillary bodies here. Let's now talk about the hypothalamus, which consists of a group of nuclei in the floor of the third ventricle, plus also the tuber cinereum, and most authors will also include the mammillary bodies in the hypothalamus. The borders of the hypothalamus go from the anterior commissure to the posterior commissure, and then from the posterior commissure down to the apex of our infundibular recess here, and will also include everything along the floor of the third ventricle in this region. So here again, I'm going to draw the outline of the hypothalamus, going from here to here in the posterior commissure, and from here to the infundibular recess, and then over here to include the chiasmatic or supraoptic recess, and back to the anterior commissure here. This will encompass all the nuclei vital for the hypothalamus. Now that we've discussed the midline structures here on this non-contrasted T1 weighted sequence, we're going to move to a post-contrast sequence, also in the sagittal plane, to show how these structures will enhance. After the IV administration of gadolinium-based contrast, we can observe the normal enhancement pattern of the midline structures of the brain. I'll start here on this sagittal section and first point out the choroid plexus, which we're beginning to see here. As I scroll toward midline, we'll see the choroid plexus as it lays along the floor of the lateral ventricles. It will go through the interventricular foramina of Monro here, and choroid plexus will also extend along the roof of the third ventricle right here. Additional enhancing choroid plexus can be expected to be found in the temporal horns of the lateral ventricles, and also down here in the inferior or medullary part of the fourth ventricle. We'll also notice normal enhancement of the tuber cinereum, which is along the floor of the third ventricle, extending from the mammillary body to the level of the optic chiasm. We also see enhancement involving the pituitary stalk, and homogeneous enhancement throughout the pituitary gland. As we'll see in a moment, dynamic imaging through the pituitary gives us a better chance to find microadenomas, as it has better sensitivity than imaging at a single time point alone. We also see normal enhancement here of the pineal gland, and if we look into the nasopharyngeal area, the mucosal surfaces here are also expected to enhance. Let's now look at some dynamic imaging to get a better sense for how the pituitary gland changes with time as contrast fills it. Here we have a dynamic sequence that will allow us to look at progressive enhancement in the cellular region. We're starting at this more anterior coronal slice and are currently looking at the anterior pituitary seen here and the optic chiasm above it. We'll move forward at approximately 10-second intervals and look at how the gland enhances. Initially, we'll notice there is no enhancement in the anterior pituitary. After a little more time, we do get peripheral enhancement, and later we get central enhancement, which begins to spread and eventually gets throughout the gland. We'll now move posteriorly and look at the posterior pituitary gland and how it enhances. So we're at another coronal slice just posterior to the anterior pituitary, and we're looking at the optic chiasm once again right here. The infundibulum is here, but will be better seen once it begins to enhance, and this is the posterior pituitary or neurohypophysis. Moving forward to the first time point, we see enhancement begin throughout the posterior pituitary. Moving forward just a little later, we see avid enhancement in the infundibulum. As we go further forward in time, we notice the enhancement here becomes more homogeneous. All this is a normal pattern of enhancement based on dynamic imaging. We expect the enhancement to start at the posterior pituitary and to quickly spread to the infundibulum because these areas get arterial supplies. In contrast, the anterior pituitary gets a supply from the hypophyseal portal system and therefore will enhance just a little later. I've switched over now to these thin section T1 weighted coronal images. We'll use these to identify our notable midline structures. We're starting here anteriorly at the level of our globes, and first I'll point out the optic nerves as they emerge from the globes, here and here. They will course posteromedially, so as I go posteriorly, we'll see them get closer and closer together. Here is our right optic nerve, and here is our left optic nerve. They will meet at the optic chiasm, seen right here. If I go a little further posteriorly, we'll see the supraoptic recess of the floor of the third ventricle, also known as the chiasmatic recess, and further posteriorly, we'll see the infundibular recess right here. Also at this point, we're seeing the posterior pituitary. We know it's the posterior pituitary because of the intense signal here, indicative of the presence of vasopressin. Also on this slice, we're seeing the optic tracts here and here, now diverging away from each other as I course further posteriorly. Next, I'll point out the basilar artery. The basilar artery, which we're beginning to see right here, has these superior cerebellar arteries and then finally these posterior cerebral arteries forming its last branches. If I go one slice more posteriorly, we'll see the basilar artery in better profile. The basilar artery is a useful landmark for identifying the anteriormost aspects of the hippocampi. Here on this slice, we're seeing our right hippocampal head, and over here, our left hippocampal head. We're also looking at the anteriormost aspect of the temporal horn of the lateral ventricle right here, and we see a little medial extension off of it, better seen if I go back one slice right here. This medial extension off the temporal horn of the lateral ventricle is known as the uncal recess. The uncal recess will separate the amygdala above from the hippocampal head below. Scrolling more anteriorly, we'll see the rest of our amygdala right here. Going back posteriorly, we'll notice that the posterior portion of the amygdala is in continuity with the medial hippocampal head right here through this gyrus known as the uncinate gyrus. The hippocampus features interlocking gray matter structures known as the dentate gyrus and the horn of Ammon, or hippocampus proper, which will curl out laterally and then inferiorly. Down inferiorly, it becomes continuous with the subiculum, which in turn is in continuity with the parahippocampal gyrus below. Together, these structures will give the hippocampus its unique appearance. Let's now talk about the white matter structures we're seeing atop the hippocampus. Right here, out laterally, we have the alveus. The alveus directs important afferent and efferent information for the hippocampus. As I scroll posteriorly, we'll notice this white matter is extending medially over here where it becomes the fimbria. I'm now at the level of the interpeduncular fossa, which is where we expect the fimbria of the hippocampus to begin. The alveus and fimbria together will feed the fornices more posteriorly. As we continue more posteriorly, we're now looking at our hippocampal bodies, which run adjacent to the brainstem. As we continue further posteriorly, beyond the posterior border of the brainstem, here are our superior colliculi and inferior colliculi, and here's our quadrigeminal cistern. There are thin strips of gray matter that curl around posteriorly and then dorsal to the corpus callosum, forming the indusium griseum. These are pretty difficult to identify, but can sometimes be seen, if I go a little anteriorly here, just over the splenium of the corpus callosum as a confluent area of gray matter. But let's go back anteriorly now and discuss the fimbria as they merge into the fornices. So scrolling anteriorly once again, here is our fimbria here on the left and over here on the right. So let's watch these structures as I go posteriorly. Here it is, and it's going to come up right about here to form the right crus of the fornix. This will go over toward midline to meet up with the left crus of the fornix. This will arc back posteriorly before going anteriorly. So if I go anteriorly now, I'll be able to follow these as they come together centrally at this point right here, where we have the commissure of the fornix. I'll continue to follow it anteriorly now to reach the body of the fornix, which is going to be right here. I'll just make note of the septum pellucidum, which comes off the body of the fornix and separates the right lateral ventricle from the left lateral ventricle. And now at this point, we're seeing the columns of the fornix. The columns of the fornix will arc anteriorly before going back down posteriorly into the mammillary bodies. So to follow these white matter fibers I'm seeing here and here, I'm now going to scroll posteriorly a few slices and watch them go down inferiorly and posteriorly to reach the mammillary bodies here and here. Sometimes these may become atrophied in mesial temporal sclerosis, as may the rest of the components of the fornices that we discussed. Going back a few slices, we're going to look at our hippocampal heads again, which we often look at closely in cases of suspected mesial temporal sclerosis. These may become atrophied as well and may lose their normal architecture. We discussed the complex architecture over here of the dentate gyrus, the horn of Ammon, the alveus fibers here, and more posteriorly the fimbria. So this fine architectural may be very distorted in cases of mesial temporal sclerosis. Other features to look for will be loss of T1 signal on a sequence like this T1 weighted sequence I'm looking at here, or on the T2 weighted sequences, you'll see increased signal in cases of mesial temporal sclerosis. The last item to touch on before we move to the axial images will be the cerebral ventricles. Here we have our right and left lateral ventricular bodies. Down here we have our temporal horns of the lateral ventricles, which as we mentioned are adjacent to the hippocampal heads. We can follow these posteriorly back into the trigone region, here and here. Sometimes these are called the atria of the lateral ventricles. Further posteriorly, we'll see our occipital horns of the lateral ventricles here and here. Now going anteriorly, back to our bodies of the lateral ventricles, we can go all the way anterior to the anterior or frontal horns seen here and here. And we can go posteriorly a little bit to see the interventricular foramina of Monro here and here, which is Y-shaped and feeds down into the third ventricle. The third ventricle we can follow posteriorly until it goes into the cerebral aqueduct. Our cerebral aqueduct will appear right here, and will then course inferiorly, back this way, into the fourth ventricle. Here's our fourth ventricle, and it has median and lateral apertures. The median aperture is called the median aperture of Magendie. The lateral apertures, seen here and here, are called the lateral apertures of Luschka. Let's now go to those axial images and review these same structures. Here we're now looking at our axial T1 weighted image set. We see our optic nerves again as they course posteromedially off the posterior surfaces of the globes. As I scroll superiorly, we can watch them converge at the optic chiasm seen here. Scrolling further superiorly, we'll see the optic tracts diverge away posterolaterally from the optic chiasm, here on the right and here on the left. This is the floor of the third ventricle, and on this slice we're seeing our supraoptic or chiasmatic recess here anteriorly and the infundibular recess behind it. We can follow this inferiorly along our pituitary stalk or infundibulum until we're at the sella region where we'll see our pituitary gland, right here. Posteriorly, we have the bright signal corresponding to the neurohypophysis, right here. Scrolling back superiorly to the level of our floor of the third ventricle, recall that the tubercinarium, seen right here just behind these optic tracts and anterior to our mammillary bodies, is a part of the hypothalamus. Most people will consider the mammillary bodies, here and here, a part of the hypothalamus as well, in addition to the group of nuclei along the floor of the third ventricle. Let's now look more laterally out at our amygdala and also at our hippocampal formations. The hippocampal formations will consist of the hippocampus proper / horn of Ammon, and the dentate nucleus and subiculum. The hippocampal formation is divided into a head region, a body, and a tail region. The head region runs posterior to the basilar artery, which we'll see better as I scroll inferiorly. So right here is the basilar artery. So if I go back up to the level of my hippocampus and draw a line out horizontally here, everything posterior to this line but anterior to a line here drawn along the interpeduncular fossa will represent the head of the hippocampus. More posteriorly and adjacent to the brainstem, back here we have the body of the hippocampus. Because the hippocampal formation goes superiorly and posteriorly, I'm going to scroll superiorly a couple slices here to get a better view of the rest of the body along here, adjacent to the brainstem. If I go further up superiorly, I'll see the hippocampal tail, which begins at the level of the colliculi, or quadrigeminal cistern. A tapering strip of gray matter coming off the tail of the hippocampus can sometimes be identified as you scroll superiorly, known as the indusium griseum. It will go over dorsal to the splenium of the corpus callosum and is not very well seen in this particular patient. But here's the splenium of the corpus callosum that it would go above. Scrolling back inferiorly now, I'd like to point out the uncinate gyrus. The uncinate gyrus forges a connection between the amygdala and the hippocampal head right here. This is our uncinate gyrus. The uncus consists of the uncinate gyrus plus also portions of the anterior parahippocampal gyrus and the hippocampal formation. Together, these structures can herniate medially and inferiorly against the tentorium. When this happens, as may be seen with masses, edema, or bleeding, you can get uncal herniation, leading to oculomotor symptoms as well as paralysis. Important white matter tracts of our hippocampal formation include the alveus, seen out laterally, and the fimbria into which it merges when we're more medial in this area. As I scroll superiorly, we'll see the fimbria here on the left and over here on the right, and we'll watch them go in to become the fornices more posteriorly. So let's follow these white matter tracts as I scroll up. We're seeing them here and over here on the left, and if I continue to follow them, we'll see them go into the crura of the fornices, here on the left and here on the right. They will come together at this point called the commissure of the fornix, also known as the hippocampal commissure, right here. At this point, they are known as the body of the fornix. Scrolling back inferiorly from this point now, we can see our body of the fornix until it becomes the columns more anteriorly. Here we see it dividing into the right and left columns of the fornix. The forniceal columns are going to arch anteriorly and then go back posteriorly right here, mostly behind the anterior commissure seen here, but there are a few pre-commissural fibers as well. And then they will go down, and most of them will go down into the mammillary bodies, which we can see as we scroll down this way to this point right here, where most of the tracts will end. Some of them, however, will go straight posteriorly into the anterior nucleus of the thalamus. We'll now review our cerebral ventricles here on these axial images. Scrolling up now to the level of our lateral ventricles, on this slice we're seeing our right and left lateral ventricle. If I scroll down a little bit, we'll see our interventricular foramina of Monro coming down, Y-shaped, down into the third ventricle below. I'll point out that the forniceal columns here will form the anterior wall of the interventricular foramina of Monro. Going back up superiorly for a moment, the portions anterior to the interventricular foramina of Monro are known as the anterior or frontal horns of the lateral ventricles. More posteriorly, we have our occipital horns going down into the occipital lobes here on the right. And here on the left, we'll see this better if I scroll down just a little bit to see this occipital horn. The point at which the occipital horn and body of the lateral ventricle, as well as the temporal or inferior horn, all come together is known as the atrium or trigone of the lateral ventricle. Scrolling further inferiorly here, we'll see our temporal horn coming off anteriorly at this point. It is going to course right next to our hippocampal head, as we discussed previously. Scrolling back up now to our level of our third ventricle right here, I'll point out that posteriorly we're seeing the right and left habenula, which will come together at the habenular commissure right above our pineal gland, which we're seeing here. We'll see our pineal gland better if I scroll down one slice. Right here, this is our pineal gland. Scrolling more inferiorly now, we'll see our posterior commissure right here. This is our third ventricle, which is slit-like between the right and left thalamus. We'll follow this further inferiorly now until we reach the cerebral aqueduct, which comes off of it posteriorly here, which will feed down into our fourth ventricle, seen way down here. The fourth ventricle will have openings laterally, known as the lateral foramina of Luschka. They're seen here on the right and here on the left. And if I go further inferiorly now, we'll see our central foramen of Magendie, or median aperture, right here. Let's now see how these midline structures look on ultrasound. Here we have a head ultrasound of an infant born at term. The series of images we're looking at now were acquired through the anterior fontanelle with the probe in the coronal orientation. The small straight footprint we see here corresponds to the footprint of a phased array transducer. Phased array transducers are able to use small probes and still acquire a large breadth of image information, and they achieve this by sequentially activating their piezoelectric crystals to steer the beam. This series of images was acquired by first pointing the probe anteriorly toward the orbits. Here we have our right and left orbit. So we're starting off in this axial oblique plane. As we rock the transducer into the vertical position, we will achieve the coronal plane. Here we are beginning to see our temporal lobes, and as we continue to rock, we'll see our lateral ventricles here and here, and we'll also see the interventricular foramina of Monro right here opening up into the third ventricle. Down here we're beginning to see our posterior fossa, and now we're approaching a coronal oblique plane as I continue to rock posteriorly. Here I'll point out the corpus callosum as the hypoechoic structure here between the hyperechoic bands above and below itself. We also are seeing our thalami here, and in the medial temporal lobes right here, we're seeing our hippocampi here on the right and here on the left. As we continue to rock posteriorly here, we're going to see our fourth ventricle appear back here at midline and be adjacent to the right and left cerebellar hemispheres. As we continue to rock posteriorly, we're going to approach the axial plane, and here we're seeing the tops of our lateral ventricles with the choroid plexus extending posteriorly here and here. We'll now turn our ultrasound probe 90 degrees to view our midline structures in the sagittal plane. We have now rotated our probe into a sagittal orientation and are again looking through the anterior fontanelle with our phased array transducer. We're starting by aiming out laterally. As I scroll medially here, we're going to see the midline structures appear. I'll first point out the trigone of the lateral ventricle out here with the choroid plexus. As we continue medially, we're going to see our lateral ventricular body here, and above it we'll get a good view of our corpus callosum. Continuing medially now, I'll point out the thalamus right here, and this important point here between the caudate and the thalamus. This is known as the caudothalamic groove. Choroid plexus will line the floor of the lateral ventricle, and then extend inferiorly through the interventricular foramina of Monro, which I'll see as I sweep more medially. Here we are sweeping medially towards midline. And right here is where we're seeing the choroid plexus come down inferiorly through our interventricular foramina of Monro. A little further medially, and we'll see it going along the ceiling of the third ventricle right here. Below this point, we're seeing our thalamus and also starting to see our brainstem. Rocking a little more medially here, we'll see our brainstem to better advantage, and we'll also see our fourth ventricle come into view, surrounded by the vermis of the cerebellum right here. An important artifact to look out for can be seen if we scroll out laterally again, around the atria of the lateral ventricles. Right here, you'll notice this apparently echogenic area. This is a pseudolesion, or peritrigonal echogenic blush, and it is attributable to the angle of incination from our ultrasound beam. In this area, the descending white matter tracts and blood vessels are nearly perpendicular to the beam, rendering them unusually reflective. The hyperechogenicity seen here should resolve as we change the angle of incination, and it should never be more echogenic than the adjacent choroid plexus. Let's go again to our caudothalamic groove and look at our choroid go right up to it, but not anterior to this point. In germinal matrix hemorrhage, you begin to have echogenicity which extends anterior to here, and that's a sign of stage 1 germinal matrix hemorrhage, which I'll show you an example of now. Here we have a different patient. Again, we're looking at sagittal ultrasound images acquired through the anterior fontanelle, and the probe is pointing out laterally to begin with. Back here we see our choroid plexus, and as we sweep toward midline, we'll see the choroid plexus line along the floor of the lateral ventricle. It extends here to the caudothalamic groove. As we continue toward midline, however, we see abnormal echogenicity right here. This indicates the presence of grade 1 germinal matrix hemorrhage. Grade 2 germinal matrix hemorrhage would have echogenic blood extending into the cerebral ventricles. Grade 3 would have interventricular blood and also cause dilation of the cerebral ventricles. Finally, grade 4 germinal matrix hemorrhage is associated with parenchymal bleeding. All the images we've looked at so far have been taken through the anterior fontanelle, which usually closes between 9 and 18 months of age. Additional views that are especially helpful in evaluating the posterior fossa can sometimes be acquired through the mastoid fontanelle, which closes between 6 and 18 months of age. Let's now look at some transmastoid images. Here with our phased array vector type probe at the mastoid fontanelle, we get another view of our posterior fossa. Here is our cerebellum, posterior to which we have the cisterna magna. Anteriorly, we see our quadrigeminal cistern, and we're also catching the posterior aspects of the temporal lobes. Right now the probe is pointed more anteriorly. If I point it more posteriorly, like so, we'll see the cisterna magna open up and also see our fourth ventricle. These transmastoid views are valuable for assessing for cerebellar hemorrhage, which will start acutely as a hyperechoic area and subsequently become isoechoic and finally hypoechoic. This concludes our review of the midline structures of the brain. Thanks so much for watching.